All right, so on to the respiratory system. So here's the first part. This first part is more involved in the anatomy part that we're going to learn in. Okay, so here it's just talking about the function of the respiratory system. So it brings in the air into our lungs, but as it brings in the air, it filters the incoming air. And so oxygen comes into our lungs, and CO2 comes out. And so really the main function of oxygen is to get the ATP from the nutrients that we consume. But as a result, that generates CO2. Okay, so I'm going to get you guys pictures on the anatomy of the respiratory system. We're going to learn about the upper and the lower respiratory tracts. Okay, so our chapter starts to talk about the nasal cavity because it's part of the respiratory system. The nasal cavity, know that it's made up of the pseudostratified tissue. And if you remember, pseudostratified tissue contains goblet cells. And the goblet cells make mucus. And so the bad stuff, the microorganisms that you're inhaling, get trapped in the mucus. And the cilia are always moving that mucus towards the pharynx. The pharynx means the throat, so it means that this dirty mucus gets swallowed each time you swallow. The sinuses, we're going to also learn about these. This will be part of your lab exam. For our lecture purposes though, know that sinuses are air-filled spaces. We have these spaces in these bones, maxillary, frontal, ethmoid, and sphenoid. So do know that these are the bones that have the sinuses. And so then these sinuses open into our nasal cavity. And the function of the sinuses is to reduce the weight of the skull. And also, it does change the voice. The effects of cigarette smoking on the respiratory system. Here I have it underlined. Smoking slows and eventually paralyzes the cilia. And so what happens is then the dirt, the pathogens cannot get removed from your respiratory tract to go to the pharynx. And this is what leads to the smoker's cough. The coughing can lead to chronic bronchitis, meaning that bacterial infections can occur. Let me write this down. When the alveolar walls are destroyed, so remember alveolar were the air sacs in our lungs, alveoli being destroyed is called emphysema. And so we're going to get to this in just a little bit. Then smoking can also cause lung cancer, 20% of the smokers. Next, the larynx. Larynx is in our neck. This is where the voice is being produced. And here in the larynx, there are the vocal cords. So we're going to see those on the next slide. And here what it's saying is there are cartilages making up the larynx. The thyroid, we're going to learn that it's the largest cartilage. The cricoid cartilage is right below. And the epiglotic cartilages are more on the backside. And so here in the larynx, where our voice is being produced, we have these different vocal cords. Here, if you notice, and we're going to see this in the lab, there are these two lines here. The upper line is referring to the false vocal cord or the fold. And so it says here that it's the upper. Know that these upper vocal cords, there's no sound being produced here. These upper folds are helping to close the trachea. So help to close trachea when we are eating, drinking. The true vocal cords though, these are the lower ones, vocal fold or vocal cord, and this is where the actual voice is being produced. And so I'm going to show you guys a video showing the vocal cords as sound is being made. Next, now we go into the lungs. The bronchial tree refers to the little branches coming off the trachea and going into the lungs. And so then these are going to take branches, give off branches to go to the alveoli or the air sacs. And so here you can see at the bottom picture, you can see those little air sacs there. Looks like tiny little grapes that have come together. Okay, so here's a very good picture showing how the trachea separates into two first to go into those two lungs. And then those little branches give off even more branches. Okay, so this is a lot of memorization, but we're also going to learn about this in lab. Here it's talking about the right and left primary bronchi. So those ones are the ones that come off the trachea. So then those primary bronchi separate into the secondary bronchi, or you can call these the lobar bronchi. Then the secondary branch into the tertiary bronchi, so these are even thinner, smaller. Those then go into the interlobular bronchioles, then the terminal respiratory, then finally to the alveoli through the ducts. Okay, so what that last slide was talking about, here we can see the bronchioles and how they're then separating to go to the alveoli. So here it says that the interlobular bronchiole, this is going to separate into the terminal bronchioles. That's the next separation. So this and this are the terminal ones. The terminal bronchioles then separate into the respiratory bronchioles. Respiratory bronchioles then lead to the alveolar ducts. Now the alveolar sac is the very center part, so that's that space. But then the alveoli are the individual air sacs there. Okay, so now this picture is showing us the gas exchange. So it's showing that the air comes in to the alveoli. The air contains oxygen, also CO2. So the oxygen is taken up, and the oxygen is going to go into the capillaries that are surrounding your alveoli. Oxygen goes in, but then the CO2 comes out from the capillaries to go into the alveoli so that you can exhale. So O2 comes in, CO2 out. Okay, next the lungs. We're going to learn that the right lung is larger. It has the 3 lobes. The left lung has the 2 lobes here. Yeah, so we're going to see these on the pictures that I'll give you. Next here, the lung irritants. Asbestos. Asbestos is airborne fibers. These fibers can lead to scarring of the lungs, shortness of breath. It can lead to lung cancer, mesothelioma. Then berliosis. This is an element used in some industrial applications. In some people, exposure to berliosis beryllium causes an immune response that also scars lungs and impairs breathing. Other, like allergic alveolitis, meaning it could be from pollutants, irritants in the air, and these can also cause fever, breathing impairment. And then air pollution, microfine air pollution pollutants can pass through mechanisms and reach our alveoli. Air pollution can worsen asthma, I'll underline that, irritate eyes, make our eyes water, irritate our lungs, and increase the risk of lung cancer and heart disease. Okay, so now next, inspiration. Just know that this means inhaling. So I'll just write it over here. So the process of moving air into our lungs. Now a little bit of physics here, Boyle's law. Boyle's law says that when the volume or the size of the lungs increase, then air moves into your lungs. So when you make more room inside your lungs, air is going to come in. And the opposite is true. When the size of your lungs decrease, air moves out of the lungs. Okay, so what's making the size of our lungs increase and then making the air move into our lungs? It is our diaphragm and also our external intercostal muscles. When they contract, they increase the size first of our chest and then also of our lungs. Okay, so when they contract, here you can see the diaphragm moves down and it's increasing the size of the chest. And the air is able to move down. So here it says normal inhaling, normal inspiration versus maximal inspiration. So with the normal inhalation, we just saw external intercostals and the diaphragm are doing this. But if you want to get as much air in as you can, then here are these other muscles that are helping. Sternocleidomastoid can help, the scalenes. Scalenes are kind of by the neck. Pectoralis minor also helps. and the diaphragm contracts a bit more. Expiration, so then this means exhaling. Exhalation, I'll just write. Normal exhalation is a passive process, which means no muscle contraction. Let's underline that part. And so passive process meaning that instead of the muscles contracting, they're actually relaxing. And so here the opposite of inhaling is occurring. The diaphragm and the external intercostals relax. So when they relax, then the size of the chest cavity goes back to normal and the lungs go back to their original size. This is called elastic recoil, getting back to the original size. Forced expiration, trying to get as much air out as you can. This then involves the internal intercostals and the abdominal muscles. So in this case, the forced exhalation is not passive, it is actually a process. Okay, so the normal expiration, so here it says the diaphragm, the external intercostals are going to relax, but the maximal expiration, so here our internal intercostals are working for the forced exhalation, and also our abdominal muscles. Then in lab, we're going to do this activity, spirometry. So this is just looking to see if the lungs are functioning correctly and also to diagnose lung disease. Okay, a few terms here we need to learn. Tidal volume, know that this means volume of air inhaled and exhaled in a single breath. And this is going to be normal breathing. Dead space volume, how much air remains in your lungs even if you try to get out as much air as you can. A little bit of air always gets stuck inside your lungs, and it's just totally normal. Vital capacity, this is the maximum volume, maximum amount of gas that can be exhaled after maximal inhalation. And so all of these can be measured by a spirometer. In the doctor's office, the spirometer is a bit more advanced. In lab, we're going to use this small device, but still going to give us some results. And it shows here normal person versus person with emphysema. Well, people with emphysema, all these different values are much less. Bronchial asthma. Asthma refers to allergic reaction to foreign antigens, irritants in the air, and then this leads to the irritation of the smooth muscle in our trachea, in our other bronchial branches, and it leads to constriction, bronchoconstriction. And I'm circling that part because that part is important. So constriction of our airways is what asthma really is. Emphysema. In this one, let's underline that the alveolar walls are destroyed. So, as a result, the alveoli cannot function. You cannot get the oxygen from the air that you breathe in the alveoli that have been destroyed, and you can't get the carbon dioxide out. Okay, so what this results in, I'm just going to write it here, low oxygen, but increased CO2 in these people. Emphysema is a type of COPD. COPD refers to chronic obstructive pulmonary disease. COPD actually includes emphysema and chronic bronchitis. And here's a picture just showing normal alveoli versus people with emphysema.